Okay, I'm going to get started on this insurance verification tutorial. It's just a quick overview of the process. So the information you will need to get started, very important, is which physician are you verifying eligibility for? Is it a primary care or is it a specialist? And if it's a specialist, you want to take special consideration if they are mental health specialists, because very often mental health is carved out to a different company from the main insurance company. So you want to take special note of that. The other information you're going to need to have handy is the NPI number for the physician that you're verifying eligibility for, and the tax ID number under which you're going to bill for today's services. Our ProHealth tax ID, if you are billing under ProHealth, is 330633863. So make sure you have that handy. If you have other tax IDs that you also do billing for, you want to make sure that you have those handy as well. Next thing that you need to have knowledge of is, are you verifying for office-based or hospital-based? And then, of course, what type of insurance are you verifying? Is it a PPO, HMO, Medicare, Medi-Medi, Medi-Cal, or something else? Because that will make a difference. Now, the information you're going to need from your patient, of course, is a copy of their insurance card. You want to make sure you have a copy. You want to make sure you have a copy of the front and back. You want to make sure that you have verified their identity either by a driver's license or military ID, something to show that you have made an effort and due diligence to verify their identity, because we want to make sure that we are avoiding any type of fraud, and it's very common. So, and then of course their basic information, their full name, make sure it's spelled correctly, their date of birth, address, contact number, email, and what sex they are. So let's start verifying. What we want to do is work smarter, not harder. So you want to identify the easiest and most accurate way to verify the insurance. The best way and the easiest way should be through your EHR system. If you're using CareTracker or any other system that has eligibility verification linked to it, that should be the easiest way. The next easiest way would be through an online portal like Availity, Medi-Cal, or Medicare websites. Then, of course, directly through the insurance website if you can't find it on Availity. And last resort is going to be calling the insurance company, because that tends to take a long time. And you want to make sure that you're doing this at least the day before. So there's a lot of information that you're going to need to document when you're verifying eligibility. And you can either document it in the comments on the eligibility verification screen in CareTracker, or you can use a form and scan that in, and I've created a form for you. So you're going to have the insurance name, the phone number you called, and the claims address where they're sending the claims, because you want to make sure that that claims address matches the address on your insurance card. The next thing you're going to need is the patient's insurance ID and the group number that they're assigned to, if that's applicable. And then, of course, the name of the insured, because that isn't always the patient. Sometimes it's a parent or a spouse. And then the relationship of the insured to the patient. Then you're going to need to document the effective date of the policy. Sometimes it will have an end date, like let's say the policy is going to end the end of this month. So if that's the case, you should also document that for future reference. And then, of course, if the coverage is currently active or not active, whether the insurance covers the procedure or the diagnosis or the services you're going to provide, whether your practice participates in the plan, are you in network or out of network, and the limitations of the policy, including any exclusions or documentation requirements for billing. So some services might require that you submit a report or a letter of medical necessity. You need to know that information now so you can be prepared. And whether or not your practice participates in the plan, if it's an HMO plan. There are some times when an HMO will assign a patient to a doctor that's not even participating in the plan. and that will get caught on the billing side. So you don't want to waste your doctor and your staff's time having them see a patient that in a plan that you don't participate. Again, any exclusions, documentation required, whether a referral, prior authorization are needed, a letter of medical necessity, the amount of the patient's copay and deductible. If the patient has a deductible, you want to check and see if that deductible has been met. Remember that if the deductible hasn't been met, then most likely this will be treated as a cash patient. And then, of course, your verification reference number or your call number. And if you can get the name of the person that you talked to, if you actually spoke to someone. So all of that is going to be very important for you. Should there be a denial, this will help you with your claim. And then double check your notes for accuracy. Sharing is caring. You want to make sure that any changes need to be updated in your EHR system so that your biller has the most up-to-date and accurate information. Why is this important? A lot of billing systems now are set up so that when you set the copay in the system and a charge is submitted, the system will automatically open a copay line based on what you put in that patient registration. So if you didn't put a copay line, then a copay line isn't going to be opened, and any money that you collected is going to sit in limbo, otherwise known as unapplied, because the system doesn't know that the patient has a copayment to apply it to. And if the copayment changes, you want to change it as well. If the copayment is different for a specialist, then and the patient is going to see a specialist today, then today is when you want to change that. When the patient comes back to see the primary care doctor, you're going to have to change it back. And then how often should you update the system? Anytime that there is a change, you should update the system. So communicate. Insurance verification should be done 1 day in advance if at all possible. That this is only possible in the same month of service. In other words, if today is the last day of the month, you are not able to verify tomorrow's patients because it's a whole new month and everything could change. So you will have to check same day on the first of the month, unfortunately. It is important to communicate with your patient if you run into any issues verifying their insurance. And that's part of the reason why you want to do it a day in advance, so that you can call the patient and say, Mrs. Jones, I was verifying your insurance for your appointment tomorrow, and for some reason, it is not able to verify, or it is not able to find you. Can I verify the information that I have on file is the correct information? Have you had a change? This will save you a lot of time on the day of that patient's appointment. And then sign your patient up for your patient portal, because this allows you to contact them in a HIPAA compliant format. So if you're not able to get them by phone, you can send them this information or this request via the patient portal. And they will get a message saying, hey, please sign into your patient portal because your doctor has sent you a very important message. So reference forms that you should always have. Number 1 is keep a list of your provider names and their NPI numbers, very handy. Number 2, make sure you have your tax ID. Again, this is a ProHealth tax ID, and any other tax IDs that you should be verifying for. Number 3, your insurance verification form. And then of course your Medicare ABN form. And just as a reminder, for Medicare patients, if they are going to receive a service that is not covered by Medicare, you are not allowed to bill them cash unless they sign an ABN form. They are not allowed to be billed for any services without a signed ABN form. So if Medicare doesn't cover it and you don't have a signed ABN form, you are not allowed to bill them, and then you've lost money for the practice. So that was a quick and dirty tutorial on insurance verification. I'm going to bring over the insurance verification form now so you can see it. So this is the insurance verification form. Let me see if I can make this whole page. I'm not even sure how to do that, but I'll just scroll down. So patient name, date of birth, insurance information, patient insurance ID and group number, who's insured, relationship to the patient, effective date, end date. This is all very self-explanatory. I've got a spot here for you to list the procedures ahead of time to make it easier for you. And down here, your reference number. And you want to make sure you write who verified the insurance and what date the insurance was verified. So I will have this form available for you at your office. If you don't have it, you can ask me for it and I will give you a copy of it. And then the Medicare ABN form, of course, is another form that you want to have handy. And let me see if I can find one here. Here is a basic Medicare. This is the Spanish one, actually. But just to give you an idea of what it looks like, the English one looks very similar. They have it readily available online in English and Spanish to make it easier for your patients. If you don't read Spanish, just follow along with the English version and it will make your life very easy. So that is the end of this quick tutorial. I hope that it will help you. And I hope that you can share this training with your staff, especially new staff, or as a refresher. I'm always readily available if you need my help. Thank you.